Good afternoon. My name is Katie Cottle, and for my final project for JTC 300, I chose to write on the topic of increasing training for our veterinary students and veterinary technician students while they're in school. And to start, I would like to share a reason why I'm so passionate about this topic. Back in 2015, before I graduated veterinary technician school, I went through the whole training process, the 2-year education that it requires to become a certified veterinary technician. And part of that training was dentistry training. However, in my own personal experience, in a class of about 15 students, we had exactly 1 day to work on one patient. So in order for us to all get some exposure to cleaning the teeth of this patient, that only worked out to about 2 to 3 teeth per person to be able to work with. And that was it. That was the end of our dentistry training. I felt that that wasn't nearly enough, especially because I knew that I was about to start work in a general practice. And in general practice, a dental cleaning, or what's called a dental prophylaxis, is done almost daily. So that was a huge concern for me. I felt very underprepared for that. And a dental prophylaxis is a procedure that takes many steps, beginning with putting the patient under general anesthesia and then doing a full oral exam where we use what's called a dental probe to probe each tooth to see if there are pockets, check for any kind of gum recession, etc. We also have to do dental radiographs, which are tricky to actually perform. We have to scale the teeth using what's called a scaler. There's an ultrasonic one and a manual one, and that is what cleans the teeth. And we have to polish, apply fluoride, apply any kind of dental sealants if they're needed, and then, of course, recover the patient from general anesthesia. And I felt that I was not prepared to take on all of the steps of a dental prophylaxis upon graduation, and that I was going to need further training. So the problem is that I'm not the only person that feels like this. According to a study that was recently performed on veterinary graduates of veterinary school, an overwhelming 52% of them felt that in dentistry is where they felt the least prepared. And so that means that over half of our veterinary graduates were not ready to take on the dental challenges that most of them were going to face. Most veterinary school graduates end up in general practice for the majority of their careers. And in general practice, dental procedures and dental cleanings account for more procedures than spays and neuters combined. So this is a serious problem. I proposed that we extend training in the dentistry area for both our veterinarians and veterinary technicians. And to do that, of course, will cost some money, which we would have to add on to tuition, which is an unfortunate fact, but it's a necessary one. We need to allocate money towards getting more dental equipment, getting more staff to oversee procedures so that technician and veterinary students can feel comfortable in actually doing these hands-on things. The hands-on training is what comes into play at most, because that's where you get the most comfortable assessing periodontal disease, cleaning teeth, pulling teeth, anything like that. The benefits of this will obviously be overall patient health. Periodontal disease is the most common disease that's found in adult dogs and cats. And the veterinary professionals of our future need to be prepared to handle that and treat it accordingly. And there is plenty more information on this topic. I welcome you to research it, take a look at it, and if anybody has any questions or concerns, feel free to contact me. Thank you.